Hey everybody, welcome back to Do It Right with Dr. Ansu. This is a brief intro to the second part of my anxiety video. In truth, I had actually recorded the entire video previously, but it became over 40 minutes long and I realized no one's going to watch the whole thing. So I split it into what is anxiety, and the second half is going to be coping mechanisms of anxiety. I think it'll be very beneficial. Please watch the video. There's some really good information there, of things that we know, but we just don't think about, and sometimes it's good to just stop and think about the things that needs to get done and writing things down. I have seen my patients benefit from it, and I hope you benefit from it also. Please enjoy the video, and let's get started. So what are some of the ways I'm addressing my patient's anxiety? Well, when my patient first comes in, I want to find out what's causing it. I ask them questions, and it's very important for me to ask these questions. I'm asking them, when did they start feeling this way? How long have they felt it? Does anything trigger it? Is it a certain time of the day, or is it all day long? What makes it go away? Is it people who are causing the problem? Are they able to communicate with anybody about this? Do they have a support group? Are they eating? How are they feeling? Are they sleeping? And asking these questions is vital because it helps them verbalize the things that they may not necessarily be wanting to say. So for example, I have kids who are doing poorly in school, and no one knows why they're doing it, and you keep asking questions until you find out it is because the parents are separating and it's affecting their mental health, or there's something going on at school but the teachers and the parents don't know about it because the kid is not telling anyone about it. But their way of showing their response to this stressor is just by doing poorly, by shutting down. I had recently had an adult patient who confessed to me that he is suffering from anxiety, which stems from the fact that he was sexually molested as a child, and he is living with the guilt of what has happened to him, even though this was not his fault. And he was always asked for perfection from his family, and he's just been burdened by this and is starting to show signs into his adulthood. I have a patient who is afraid to work because she's been harassed so often by her previous boss that now every time she goes into a work, she's just constantly looking behind her, worried that her boss or her co-worker will be just waiting to harass her. These are anxieties people are experiencing, but they don't think about it until I ask them, and I have them say it out loud what the cause is. Because once you hear what your issue is, then we have something to work with. I really want to make sure that my patients are not labeled as someone with anxiety, but that they know the source of their anxiety, so we have real goals and real things to work with. Once we get to the possible cause or stressor of the anxiety, then it's a little easier to work with cognitive behavior therapy. So I just want to say what I tell all my patients. I am not a therapist, I am not a psychologist, I did not go to school for counseling, but I'm a family practitioner and I have been trained to deal with mental health, including CBT. So when my patients come in and we are talking about things and now we know the stressors, I like to use CBT, which is a talk therapy. It's a evidence-based medicine that is known to show good signs and good results for people who are dealing with depression, anxiety, trauma-related disorders. Essentially what we're trying to do with CBT is that we're trying to help patients cope with their symptoms of anxiety. We're trying to give them ways to look at their stressor in a different way so they are able to function better, and that their stressor and their anxiety of that stressor doesn't prevent them from living their daily lives. The CBT model realizes that the cause and reason for some of these psychiatric disorders is that there's a problematic pattern in the way of thinking and behavior that lead to poor ability to function in life. So let me give you an example. I have a patient who unfortunately lost several family members to COVID. She herself had COVID and she was hospitalized for a few days, and she's just been so traumatized by this illness that now she is scared to walk outside of her house. She doesn't want to talk to anybody. She doesn't want to see anyone. She never wants to go into the hospital because she is afraid that if she ever goes into the hospital, she is not going to come back. COVID pandemic has ruined the way she's lived life, and it's impaired her functionality. She was able to work at one point. Now she can't work. She doesn't socialize. She doesn't have a social life, and she's just suffering alone. On top of that, she fails to realize that this is anxiety that's causing it, because in her culture, anxiety or any mental health disorder means that you're crazy, and she doesn't want to be crazy. So when she was talking to me about what she's experiencing, and I told her, you're experiencing anxiety, she refused to believe that. She does not want to see a therapist because she does not think she has anxiety. This is an example where someone who was able to function properly took something, a stressor, which was COVID, and the trauma that has come with COVID in her life and her family's life, and now it's preventing her from living life properly. You know, she is functionally impaired because of what anxiety is doing to her, to the point that she doesn't want to even ask for help. The only person she was actually willing to talk to was me, who she's established care with before, and it took a long time to have her get past that. And if I, as a family practitioner, wasn't providing her that mental health care, she may have never gotten better. And that is my role. You know, as a family practitioner, I am doing more than just making sure their diabetes and high blood pressure is under control. I also want to make sure their mental health is under control. There are times when patients call with these issues, they're expecting a medication so their anxiety goes away. And I quite often tell them that, you know, a pill is not your answer. A pill will make you feel better for a little bit. It may even help you address some of these stressors because you feel a little calmer, but it doesn't take the stressor away, and it doesn't take their response to the stressor away. So the medicine is more masking their symptom than actually helping them with their symptom. And the CBT model actually has shown to be just as effective, if not more effective, in cases of anxiety and depression than medicine alone. So how do I address anxiety and help prepare my patients to cope with their anxiety? I encourage my patients to draw on social support. When people are going through anxiety, they feel like they're alone, that they have to suffer through everything on their own, that people will not understand what they're experiencing, that they don't have anyone to rely on. So when my patients come in for anxiety-related issues, I want to know who their support system is. Sometimes their family may be the cause of their anxiety. Then I want to find out who else is there. Do they have a friend? Do they have a teacher? Do they have a coach? Do they have someone at their gym? Do they have a community group? Do they have a church group? Are there people that they think that they can rely on for sound wisdom? And I want them to reach out to them. So for example, in the patient I just mentioned, who felt like she couldn't reach out to anybody, who felt she was alone and she was suffering alone, she did have a church group who she wasn't seeing in person because of COVID, but she had some people's numbers. So my assignment, our goal was that she would call somebody every day, a different person, and talk to them for about 5 minutes. By the time she followed up with me, it was amazing how many people she could actually call and she felt she could connect to and who understood what she was experiencing. And so that by the time she came to me next week, she realized that she actually was not alone, that she did have a community that she could turn to, and that she felt her burden was slightly lessened in comparison to the week before. Quite often when we're in the middle of things, being grateful is not what we think about. We are just so overwhelmed with all the negativity around us and the negativity inside of us that it makes it really hard to look at anything positively. So when my patients are coming in with all the anxiety that they're surrounded by, I ask them to write in a gratitude journal. It's not a lot. I don't want them to journal a whole thing. Usually I just say, write one thing, So first day, write one thing you were thankful for. I woke up, I'm breathing, I'm living. Next day, write 2 things that they're thankful for. I am thankful for a job. I am thankful for my kids. Third day, write 3 things, and each day to increase it. And again, by the time my patients follow up, if they have written a gratitude journal, they are surprised by how many things that they're actually thankful for that they forget about in the midst of their anxiety because they stop to think about the good things that are going on. And again, that helps them change their perspective a little bit. There are patients who don't want to write in a gratitude journal. It just seems too much for them. And for those, I tell them to just have a post-it and write 1 or 2 things that they like about themselves and that they're thankful for, and to post it somewhere that they will see every day, whether that's their bathroom mirror, the refrigerator, or the television, somewhere that they will be looking at every day. And when you look at those post-its, I am loved, I am beautiful, I am alive, those daily reminders can be very helpful in changing our perspective, because we're not waking up with negative thoughts. We are getting some positivity first thing in the morning as we get up, and it can be very helpful to just change your perspective throughout the day. I also recommend breathing exercise and being mindful. People hear about breathing all the time. You talk about calming down and just taking some deep breaths, and there is science to that. When you take deep breaths, your parasympathetic nervous system takes over, and it helps with a sense of calmness. I tell my patients when they're feeling extremely stressed out, do a 4-count breathing technique, and that's essentially you're breathing in for 4 counts, you're holding it for 4 counts, you're exhaling for 4 counts, and you're holding it for 4 counts. And just that very action of that deep breath in and out can be very helpful in relaxing them. If they're starting to feel panicky, it helps calm them down. I also want them to be mindful. And mindfulness, we hear that a lot, and people kind of think of mindfulness and they put it into the context of yoga or meditation, but essentially mindfulness is being present. It's being aware of what's happening right now. So when my patients are going through their anxiety, I want them to practice mindfulness, whether that's through meditation, through prayer, through quiet time, through yoga, whatever it may be. I just want them to take some time to be present in that moment where they're not thinking about all the stressors in their life. They're thinking about that moment and being present to themselves. These kind of exercises can be very beneficial in just relaxing our body and relaxing our mind and taking it off of the stressors in our life. Speaking of exercise, physical exercise is extremely important and valuable when people are experiencing anxiety or depression. Exercise increases your adrenaline, and it helps increase the energy level that you're feeling, and it can be a wonderful way of removing some of those stressful negative emotions that you're experiencing. When people exercise, they're also feeling better about themselves. They feel like they've accomplished something, and it can be very helpful to address their anxiety. I'm also mindful about being realistic with my patients about their exercise. I am not going to ask my patient who's 300 pounds, who can barely move, to go do a 30-minute aerobic exercise. It's not realistic, and it's not going to be accomplished if I put it that way. But I do want them to move. So whether that's a 5 to 10 minute walk while they're listening to something that calms them down, whether that is getting up every hour while they're sitting and down and working and just walking around, it's something that they don't usually do, but that gets their body moving. But physical exercise is extremely important. For example, I have a patient who barely got 700 steps in her day. She was extremely obese, and she was very sedentary. She worked from home even before COVID happened, and she showed me that she barely moved 700 steps. And my assignment to her was, well, let's make that 1,000 steps, and I told her how she can do it, every couple of hours, just taking 5 minutes to just walk around, going up and down the stairs, at the end of the day, going around the block. And she came to me in a couple of weeks, and she had actually accomplished 1,300 steps. And we were happy with that, and then we moved it to 1,500 steps, and it's these small victories that make a huge impact. And that's important. You want to do small things so you can, over time, see a greater impact. If you aim for big things, you may not always reach it, and it's very easy to give up. That's what I remind my patients, to make those small changes. When we talk about physical exercise, if my patient's like, next time I'm going to lose 10 pounds, I like to remind them, let's start with 3 pounds, because if you're able to accomplish that 3 pounds, you can do another 3 pounds until you get to that 10 pound. But if you're not able to reach that 10 pound, you may feel this is another thing to add to my anxiety, and I don't want them to add more negativity. I want them to have positive reinforcement. Creating a routine is extremely helpful, especially when you're suffering with anxiety. For some of my patients who are dealing with anxiety, part of it is just they feel like there's so much to do, there's so much to accomplish, and they just cannot get their minds wrapped around things. So creating a routine where you have a schedule, where you know when you're going to be working, when you know when you're going to be taking some time off, where you're going to be doing self-care, where you have time for a hobby, those things help, one, to accomplish things, but it also makes time for you to do things that you may enjoy. If you don't have a routine, you may work all day long and you may feel like you haven't accomplished anything. But if you have a routine and you stick to it, it's a lot easier to start seeing things get done, but also get time to take a break. I also try to increase frequency when my patients come in with anxiety or depression, because I don't want them to get lost in, scheduling. I want to make sure that they're doing well. I want to make sure that they are being followed up properly in case they were not able to see a therapist, in case they were not able to get in with somebody on time. Because the sad reality is there's not enough psychologists, there are not enough therapists right now for all the mental health issues that are going on. And I've had a few patients where I've made several referrals and they just can't get in to see anyone on time. So I like to follow up with them until they are able to get in with a specialist, whether that's a therapist or a psychiatrist, because I want to make sure that we are getting somewhere, that we are achieving goals, and that they are at a better place than the first time they came to me. So for example, again, my patient who did not want to leave her house, I was seeing her weekly via telemed because she didn't want to see a therapist, she didn't want to see anybody else. So every week we were talking to see how she was doing, and then she was able to come out to see me until she felt she was at a place where she could start seeing a therapist, which was a huge goal for us. And that's what I want. I want my patients to get to a point where they feel like they are ready to take their self-care to the next level. I do consider medications in cases where I feel like it's needed. So for example, if a patient is experiencing panic disorder and they're just not able to function because they're just having a full-blown panic attack, they are sweating, there's palpitations, there's tremors, they're just not able to function properly, I may consider putting them on a medication that may help address that a little bit. But I do that in conjunction with the cognitive behavioral therapy. Those two have to go hand in hand. Medication by itself is not sufficient for acute anxiety. It is not the right treatment alone. It needs to go in conjunction with therapy. I also remind them that they may want to limit exposure to things that is causing their anxiety. So for example, people come in anxious because of politics that are going on, with everything that's happening in the world, which is unfortunate. Terrible things are happening, but if it's affecting their anxiety and it's preventing them from functioning properly, then they need a time away from it. So I tell them, you maybe need to get off of social media, maybe you need to stop watching news so much, maybe you need to be not around the kind of people who will worsen your anxiety, because you need time away from the stressors to help give you enough time to strengthen yourself, so whenever you do have the stressor, you know how to handle that. And finally, I like to share resources, because the truth is I can do a lot of talking with my patients, we can make a lot of plans, but if they don't have something that they can hold on to, something that they could use when they're on their own, I may lose them. So I like to give them resources, whether that's apps or websites or handouts, just so they have something else that can be of help. There are some apps that I've added at the bottom of this video in the information section that you can look into, and there are some websites that can be very helpful. So I like to use all of these to prepare my patients and provide goals, and that's important. My patients, they know that we're a team, and I like to emphasize that. I remind them, I can tell you all the things you want, but if you're not going to do your part, this is not going to work. I will do everything I can to help you, achieve your goal, but you need to do your part also. And my patients believe me because they know me and they know that I'm invested. They have this past with me. And that's one of the benefits of being a family practitioner, addressing mental health, because you have already established this relationship with your patient on other things. And they know that if you care about their health, that what you're telling them about the mental health is just as important. And I have loved addressing anxiety and depression for my patients, and I've loved seeing some of them come out of it without any medications, and come out of it so much stronger. And I hope that if you're watching this video and you're dealing with anxiety, my most important advice to you is please get help, whether that is your primary care provider, whether that is a group that you trust, whether that is just someone at home. Tell them the burden that you're feeling so you can take that and share that with them and hopefully address your anxiety. Please do not suffer with it alone. There are lots of resources. Look at the information below. Please know that you're not alone. You're not suffering alone. As I said, anxiety is something practically every person experiences, probably multiple times in their life. And a lot of people are suffering alone because they think they are the only one going through it. No one can understand. But the truth is, everyone is going through it. No one just wants to talk about it. So please reach out, get the help that you can so you can actually help somebody else who's experiencing something similar. And with that said, I hope that you enjoyed this video. I hope that you gained something from this video that was of some help. If you feel like you are suffering anxiety and maybe this video encouraged you to bring that to your primary care provider, please do so. Please do not suffer alone. And if you want to learn more, please send me a comment at the bottom. I will try to address it as soon as I can. If you like this video, please give it a thumbs up, and please come back with my next video where I will be addressing the physical symptoms of anxiety with the neck and upper back pain, and share some osteopathic manipulation with you guys. Until then, please take care and come back to learn more about how to do it right with Dr. Ansu. Bye!